So if you now chop my head off for being a terrible guest and you just clean my head straight off, my body wouldn't just kind of like relax into its place, would it? All the muscles would tighten up. Those first order neurons in the spinal cord would say, I think sometimes the way we think about the brain is, I want to close my hand, and a signal goes from my hand to those muscles say turn on, when actually it's much more complicated than that. The first order neurons want to do this. The corticospinal tract, those lower motor neurons want to do this. It's the upper motor neurons that are saying, hey, chill out, don't do it. When we have chronic pain, we have chronic stress, anxiety, depression, we lose that descending inhibition of those lower motor neurons, and they're allowed to come to a little bit more tension. Now, not enough that my arm suddenly goes into spasticity, but enough that every muscle is tighter. Often it's going to be that flexor system. So think of someone who's stressed at work, kind of hunched behind the computer. So when we come back to this diagram of the brachial plexus, we're going to increase that flexor tone. We're going to compress these nerve compartments. So again, if we're having this constant trickle of pain, where these nerves are constantly getting compressed, we may not have had a whiplash or a sudden disc herniation, but we can just have this constant compression where this pain system is trickling. And now actually what used to be some tightness in my neck and shoulder has now developed into my right arm is sore, my whole right side of my back is sore. If that pain process goes on for long enough, it starts to mirror. So initially I might say the whole of my right side is painful, and then we can say actually it's mirroring onto the other side, and then from there it becomes something like fibromyalgia, where you have this kind of widespread pain. So when we're looking at these pain pressure thresholds, we know that someone who has a single episode of low back pain will be able to take more pressure than someone who has recurrent low back pain. So I hurt my back a few times a year. They'll take less pressure before they say ouch, before someone who's hurt their back once. Yeah. Someone who has chronic mild low back pain will take less pressure before they say ouch than someone who had recurrent, and it continues. So someone with severe low back pain takes less pressure than mild, and someone with fibromyalgia has less pressure than all the others.
And you said we know this on the basis of good quality evidence? Good quality
correlational studies where they basically take different pain syndromes. And have you seen a algometer?
Yes.
Where you basically see how much pressure?
Yes.
So
in fact, we had one in the studio not that long ago.
Okay, so that's exactly it. So basically they'll just make sure that the person is putting the same amount of pressure each time for controls, and then basically look at how much pressure everyone else can take. But there's been quite a lot of research onto it, so it's not I'd love to say it's a new thing that I've come up with, but it's
no, and I wouldn't mind if it were a lovely new thing that you'd come up with, but of course, when we're trying to explain things to patients, we want to make sure that we are telling them stuff which is based on evidence. You know, it's in the chiropractic code, it's in our osteopathic practice standards. And of course, if we want to talk to other healthcare professionals, we've got to make sure that they don't say, oh, this is just your theory about pain, and you would say that because you're a manual therapist.
Yeah, absolutely.
Yeah.
You've almost got more to prove, really, haven't we?
Yeah, I quite like those ergometers. I'm not sure he was calling them ergometers, but I mean they were power pressure tools. But we also had the same physiotherapist came in and demonstrated some really good Bluetooth devices for measuring movement as well. So you could do rotation of the head, side bending of the head, flexion of the limbs, and of course it gives you a fantastic objective answer to just what difference have you made to this patient after one session or when they come back in at the next session.
Yeah, absolutely. And that is something we should see, is you should test before and after your treatment. And so with chronic pain, obviously, we're very unlikely that we're going to do a treatment and they're going to go up and all that stuff is gone. But we should see if these secondary hyperalgesia is present, that there should be an improvement. So let's say I had pain all the way down to C7, so you're squeezing my finger and I'm like, oh, that is really sore. You then do the treatment and hopefully you should then be saying, oh, actually, that's not bad. No, it's fine. Yeah. Oh, yeah, that's sore. So we should see this regression.